outbreaks of cholera and meningitis, and more importantly, provide an update on measures being taken by government to contain the spread of these diseases. Mr. Speaker, as you are aware, Ghana is currently facing outbreaks of cholera and meningitis. Additionally, a single case of human metapneumovirus has also been detected in the country. Before I go further, Mr. Speaker, I want to express my sincere gratitude to all our health workers for their unwavering dedication and resilience. In the past week, I had the privilege to interact with healthcare workers in health facilities and communities in the Upper West, Greater Accra, and Central regions. Their tireless efforts on the front lines of these outbreaks are truly commendable, and we as a nation are deeply indebted to them. Mr. Speaker, His Excellency John Dramani Mahamat's government, in the face of limited resources, came to office with a pledge to build a more robust healthcare system that, among other objectives, will prevent diseases and promote good health. Mr. Speaker, we remain fully committed to this, and the leadership and support for these disease outbreaks in the past few weeks is a clear demonstration of government's commitment. Mr. Speaker, I will now share the update on the specific diseases and the measures taken to bring the outbreaks under control. Mr. Speaker, cholera outbreak. Mr. Speaker, cholera is caused by the bacterium Vibrio cholerae. Affected individuals may experience a sudden onset of profuse watery diarrhea, often accompanied by vomiting. This can lead to rapid dehydration and further complications if not treated promptly. Mr. Speaker, the time between exposure to the bacterium and the appearance of symptoms called the incubation period ranges from 12 to 48 hours, with an average of 2 to 3 days. Mr. Speaker, cholera transmission occurs primarily through consumption of water or food contaminated with fecal matter. This contamination can happen in various ways, including, Mr. Speaker, direct contamination of drinking water, water source with sewage, consumption of raw fruit and vegetables that have been irrigated with contaminated water, poor food handling practices that allow for cross-contamination. Mr. Speaker, several factors contribute to the persistence of cholera in our communities. These include poor sanitation and hygiene practices, particularly open defecation, which unfortunately is still prevalent in many areas. Inadequate access to safe drinking water, especially rural and peri-urban communities, as well as erratic water supply, which compels people to rely on unsafe sources. The presence of street food vendors who may not adhere to proper hygiene standards. Mr. Speaker, I must put on record that the current cholera outbreak began over 5 months ago in October 2024 in Ada West in the Greater Accra region. Mr. Speaker, since the outset in October 2024, it has unfortunately spread to other districts in Greater Accra and 4 other regions, namely Central, Western, Ashanti, and Eastern regions. Mr. Speaker, as of 13 February 2025, we have recorded 6,145 cases, 719 confirmed cases, and unfortunately 49 deaths. In all, 5 regions have reported cases since the outbreak began. These are Greater Accra, Central, Western, Ashanti, and Eastern regions. Mr. Speaker, it is worth noting that the situation is improving, with active cases now concentrated in the Central region only. Mr. Speaker, allow me to elaborate on the situation in the Central region. This region has been particularly affected by the current outbreak, with significant number of cases reported in recent weeks. The district of Agona West and the Futu have been particularly hard hit. In the past week alone, these 2 districts reported 133 cases, 23 admissions, and unfortunately 2 deaths. Despite worrying situation in the Central region, Mr. Speaker, I bring encouraging news. New cholera cases are decreasing, and the district of Agona West and the Futu, which were initially hard hit, are now showing a decline in new cases. Mr. Speaker, as of 16 February, only Central region had active cases. The region reported a total of 28 active cases on admission. Efutu 18, Cape Coast 6, Agona West 4 cases. Mr. Speaker, the positive shift is a testament to the relentless effort of our health workers and partners who have been diligently implementing a robust response plan. This plan includes heightened surveillance to swiftly identify and manage cases, strengthen laboratory capacity for accurate and timely diagnosis, and environmental assessment to pinpoint and address risk factors. We have also established a cholera treatment centers and are conducting public awareness campaign to educate communities. The strategic deployment of oral cholera vaccines in high-risk areas is further contributing to this positive trend. Mr. Speaker, please permit me to now highlight the measures that have been taken to respond to this outbreak in order to bring it under control. In doing this, I must add, Mr. Speaker, that the response to cholera is multi-sectorial. The Ministry of Health, in collaboration with various partners, has a comprehensive response plan in motion. The actions are as follows. Coordination. We have activated regional and district public health emergency committees in all affected regions to ensure a coordinated response. Surveillance. We have heightened surveillance in all districts with active community case search and contact tracing to identify and manage cases promptly. Laboratory. We have strengthened laboratory capacity to test and confirm suspected cases, ensuring accurate diagnosis and timely treatment. Environmental assessment. We have conducted environmental assessment in all affected districts to identify and address risk factors such as poor sanitation and water supply. Case management. We have set up a cholera treatment centers in affected districts and provided training to healthcare workers on case management and infection prevention control, risk communication, and community engagement. We have launched public awareness campaign to educate communities about cholera prevention and control measures. Vaccination. We have deployed oral cholera vaccines in high-risk areas to protect vulnerable population and prevent further spread. Permit me, Mr. Speaker, to provide additional details on cholera vaccination. Phase 1 and 2 sub-national oral cholera vaccine campaign were completed in 5 districts in the central and western regions: Awutu Senya East, Sekondu Takoradi, Efia Kwesimintim, Shama, and Ahanta West. A total of 596,205 people, representing 92.9% of the target population, were vaccinated. Subsequent to phase 1 and 2 vaccinations, OCV were approved for Accra Metro, and vaccination just ended. The period was from 14th to 17th February. As of Sunday, February 17th, a total of 370 people had been vaccinated in Ablekuma, Asiedu Keteke, Okankwe, and Accra Metro areas. We have also secured approval for vaccination for Agona West and submitted an application for Efutu. Mr. Speaker, despite our effort, we continue to face challenges in our response to the cholera outbreak. These challenges include poor sanitation and hygiene practices and limited access to safe water. As you can see, Mr. Speaker, cholera persists in our country for a reason. It persists because of a poor sanitation, including open defecation, unsafe water, and unhygienic food. As a result, Mr. Speaker, cholera requires a multi-sectorial approach in our effort to bring it under control. I use this opportunity to thank our local authorities who have been supporting the response and call on them to do more. Most importantly, Mr. Speaker, in the long term, we will need to improve our sanitation situation, food and water safety, and personal hygiene to rid our environment of cholera and ensure that even when there is an outbreak, it does not have suitable conditions to facilitate spread. Now, Mr. Speaker, meningitis. Mr. Speaker, meningitis is an inflammation of the meninges, the protective membranes that surround the brain and spinal cord. It is characterized by a range of symptoms, including fever, headache, nausea, vomiting, neck stiffness, confusion, convolutions, and in severe cases, coma. Mr. Speaker, meningitis outbreaks in Ghana typically occur in the northern regions and nearby districts in the Bono and Oti regions. These areas lie within the meningitis belt of Africa, which stretches from Senegal, Gambia in the west to Ethiopia in the east. Meningitis belt experiences seasonal outbreaks during the dry and hot weather conditions, often referred to as the meningitis season. In Ghana, this meningitis season extends over the Harmattan months from October up to March. Mr. Speaker, it is worth noting the following, which informs the response to the meningitis outbreak. There are a number of organisms that may cause meningitis, including virus, bacteria, etc. Some of these can be prevented by vaccination. In Ghana, two main types of pathogens cause outbreaks: Neisseria and Streptococcus. Based on the type of Neisseria, the population can be vaccinated. However, vaccination does not apply to Streptococcus, which is the strain currently causing havoc in the Upper West region. This means that currently vaccination is not one of the measures we can use to control the ongoing outbreak. It is worth noting, Mr. Speaker, that Streptococcus is very fatal and usually starts early in the meningitis season, only to be followed by Neisseria, which is less fatal but spread wider and responds to vaccination. Mr. Speaker, I must put on record that the current meningitis outbreak in the Upper West region is rightly a cause of serious concern. This concern is not just because of the current outbreak, but because the Upper West region has consistently recorded high numbers of meningitis cases during the dry season in recent years. Mr. Speaker, in the current season, as of Sunday, 16 February, we had recorded over 129 cases and unfortunately 16 deaths, while 29 people are currently on admission. The districts most affected, Mr. Speaker, are Wa Municipal, Nandoli, Wa West, Drapa, and Nandom. Mr. Speaker, despite the substantial number of cases and unfortunate deaths, I wish to assure the House and the good people of Ghana that we have made considerable efforts to keep the outbreak under control. Our efforts are paying off, Mr. Speaker. Already, a wave of improvement is evident in the Upper West region, where new meningitis cases are decreasing. This positive change follows the Ministry of Health's swift and decisive actions, which included deploying experts to support local teams, conducting a high-level visit to assess the situation and providing support, and ensuring free treatment for all affected individuals. We also activated the Emergency Operations Center for coordinated response efforts and engaged in consultations with international experts. The mobilization of essential antibiotics and targeted public awareness campaign have further boosted our efforts controlling the outbreak. Mr. Speaker, please permit me to highlight some of the specific measures by the Ministry of Health and its partners in response to the meningitis outbreak. Deployment of experts. We have dispatched a team of experts from the national level to support the regional and district health teams in managing the outbreak. Free treatment. We have exempted all individuals affected by meningitis from paying for treatment, ensuring that everyone has access to the care they need. Emergency Operations Center. We have activated the Emergency Operations Center at the national and the regional levels to coordinate the response efforts. Coordination meetings. We are holding weekly coordination meetings with meningitis experts from the World Health Organization to ensure that our response is aligned with international best practice. Mobilization of antibiotics. We have mobilized additional antibiotics to to support the regional medical stores, while ICG has also approved 10,000 vials of ceftriaxone, the antibiotics used in treating meningitis, to ensure that there is no shortage of essential medicines. Public awareness. We have launched intensive public education campaigns to raise awareness about the signs and symptoms of meningitis and encourage early reporting to health facilities. Community engagement. We have engaged with the community leaders and opinion leaders to solicit their support in raising awareness and encouraging community participation in the response. High-level visit. The minister responsible for health, myself, and the Director General of the Ghana Health Service have conducted a high-level visit to the affected communities to assess the situation and provide support. International assistance. We have also secured technical assistance from the WHO through delegation of an expert to help us improve our management of meningitis outbreak in the Upper West. Human metapneumovirus. Mr. Speaker, we have also identified a single case of human metapneumovirus, HMPV, in the country. Human metapneumovirus, HMPV, is a respiratory virus that can cause a range of respiratory illness from mild cold-like symptoms to severe pneumonia. While it can affect people of all ages, it is most commonly seen in young children, older adults, and those with weakened immune system. In response to recent increase in respiratory cases in China and some temperate countries in December 2024, as part of our routine surveillance, we commenced testing for human metapneumovirus HMPV this year in January 2025. So far, a total of 90 samples have been selected for testing, and only one positive case has been detected for HMPV. This was detected from an elderly person. Mr. Speaker, I want to assure the House that the risk of HMPV in Ghana remains low. As you can see, we have a robust surveillance system in place to monitor for respiratory viruses, including HMPV. In fact, these systems have been strengthened in recent years, particularly following the COVID-19 pandemic. We therefore assure the country that any case of HMPV will be quickly identified and managed to prevent the spread. Mr. Speaker, the Ministry of Health is fully committed to working with our partners to control these ongoing outbreaks and to protect the health of all Ghanaians. We have implemented a range of measures to address these challenges, including strengthening surveillance to detect and track cases, providing timely and effective treatment to those affected, raising public awareness about prevention and control measures, collaborating with local and international partners to coordinate our response. In addition to these technical interventions, in line with the aspirations of His Excellency John Dramani Mahamat's government, I would like to emphasize that effective control of this outbreak is of utmost importance to my office. It is for this reason that in the past week alone, I joined health workers at health facilities and in communities to better appreciate the issues on the ground in order to provide more informed support. Mr. Speaker, together with my team, we have been to the following places: Upper West, Meningitis Response, the Regional Health Directorate, Warnas Palace, Nadoli District Hospital, Queens of Peace SHS, War Regional Hospital, and then in Greater Accra for the cholera response, Mamprobi Hospital, Matters of Uganda School, Winneba Municipal Hospital, Winneba Township, Winneba Beachfront, Swadro Municipal Hospital. Mr. Speaker, at this juncture, I would like to encourage all health workers, especially those in the hard-hit districts, to support the ongoing response to the outbreak. Similarly, I would like to call on the municipal district assemblies, including local authorities responsible for water, sanitation, and food safety, to actively play their part in enforcing local bylaws ensuring access to safe water and food, and supporting awareness creation. In addition, I also appeal to our friends in the media to support the public education and awareness some more to fully prevent any further spread of these outbreaks. Mr. Speaker, as I end, permit me to call on my fellow members of Parliament to support the local authorities and health workers to educate on our fellow countrymen and women on how to prevent these diseases and the important need to report early to the health facilities when they have symptoms suggestive of any of these diseases. This helps to prevent further spread and complications, including unfortunate loss of lives. Mr. Speaker, finally, I want to reassure the House that we are doing everything in our power to contain these outbreaks and safeguard the health of our nation. We will continue to monitor the situation closely and provide regular updates to the House and the public. Mr. Speaker, before I end, let me use this opportunity to acknowledge some of the assistance and donations some honorable members have also made in this direction. The Speaker, the Right Honorable Speaker, has made significant donations to the Upper West region in the fight against meningitis. Equally, Mr. Speaker, the Minority Leader, Honorable Kwabena Mintah, has also contributed to the fight against cholera in the Futu. Thank you so very much for the opportunity, Mr. Speaker.
Honorable members, that is the briefing statement by the Honorable Minister responsible for health. Honorable members, I will open the floor for comments, but let me remind ourselves about Standing Order 91, 3 and 4.